My name is Jonathan Roberts. I'm the Associate Medical and Research Director for the Bleeding and Clotting Disorders Institute and Associate Professor of Pediatrics and Medicine at the University of Illinois College of Medicine in Peoria. I've known James for almost his whole life. He was diagnosed at birth with severe hemophilia A. He also has a younger brother with severe hemophilia A. He's a very active player on a traveling baseball team. He's 11, he's experienced a lot of different therapies, standard half-life factors, extended half-life factors, non-factor therapy, but he and his family are concerned because he's experiencing some breakthrough bleeding events while on a non-factor therapy that was necessitating more factor infusions than he would have liked. That really kind of brought into the conversation Altuvio. So things to consider for James was really, he was frustrated with some of the breakthrough bleeds that he had, but he wants to continue playing baseball. Being on the non-factor therapy in general went well, but then some imaging revealed that he had some early hemophilic elbow arthropathy. He was on a standard half-life factor for 3 years, an extended half-life factor for 4 years, currently was on a once-weekly factor VIII mimetic for 3 years and was adherent to therapy, nevertheless was having some breakthrough bleeds. His right elbow was his target joint, and he has no history of inhibitors and no hospitalizations for his hemophilia. So in considering Altuvio for him, safety is a big importance for the family, especially with starting a new therapy. The Extend Kids was a 52-week multi-center phase 3 trial for children who were less than 12 years old who had severe hemophilia A. These patients were put on prophylaxis and then have been continued to be followed on the extended trial up to 4 years. The primary endpoints of the Extend Kids study was met with 0 neutralizing antibodies detected. After 2 years, the long-term efficacy of Altuvio in children and extended was similar to Extend Kids. The mean overall ABR was 0.67, with very few spontaneous bleeds of 0.06, low traumatic bleeds of 0.46, and low joint bleeds of 0.29. The median ABR again was 0. And when you look at the overall patients with 0 bleeds, around 80% of patients had no bleeds whatsoever, with even higher proportion not having spontaneous bleeds, over 97%. If a breakthrough bleed did occur, a majority of bleeding episodes were treated with 1 infusion. So in Extend Kids, 95% of bleeding episodes resolved with a single infusion of Altuvio, 50 units per kilo. And in children in the extended study, over 88.5% of bleeds were controlled with 1 injection, with over 8% resolving after 2 doses. So children who do have breakthrough bleeding events on Altuvio are well protected, with most of them only needing 1 infusion. Getting back to James, he's been doing well on Altuvio for over a year now. He had been previously frustrated with those breakthrough bleeds that have now resolved with being on Altuvio prophylaxis. No inhibitor is present, and his factor VIII activity is 42% at day 3 post-infusion and 12% at day 7. So he continues to excel in his baseball participation, and he looks forward to even participating into the future. The thought of switching to 1 therapy with Altuvio and getting weekly infusions was really appealing to him and his family. His family's great. They're very well educated now on hemophilia, living with it in James and his brother, and also family history of maternal grandfather who also had hemophilia. So the mean treatment duration of patients on the extended trial was over 120 weeks from Extend Kids and over 68 weeks during the extended study. Similarly, the mean exposure to Altuvio was over 120 exposure days from Extend Kids baseline and 67 exposure days during the extended study. In the Extend Kids and extended trial, factor VIII inhibitors did not develop, with an incidence of 0 for inhibitor formation in extended. The most common adverse events in children, over 12%, was pyrexia. The most common treatment emergent adverse events were cough, arthralgia, and pyrexia. There are no reports of serious allergic reactions, and there is no adverse events leading to discontinuation or death in the study.
Formation of neutralizing antibodies, inhibitors to factor VIII, has been reported following administration of Altuvio. Indication: Altuvio is indicated for use in adults and pediatric patients with hemophilia A, congenital factor VIII deficiency, for routine prophylaxis to reduce the frequency of bleeding episodes, on-demand treatment and control of bleeding episodes, perioperative management of bleeding. Limitation of use: Altuvio is not indicated for the treatment of von Willebrand disease. Important safety information: contraindications. Altuvio is contraindicated in patients who have had severe hypersensitivity reactions, including anaphylaxis, to the product or its excipients. Warnings and precautions. Allergic-type hypersensitivity reactions, including anaphylaxis, have occurred with Altuvio. Discontinue use of Altuvio if hypersensitivity reaction occurs and manage symptoms as appropriate. Formation of neutralizing antibodies, inhibitors to factor VIII, has been reported following administration of Altuvio. Monitor all patients for the development of factor VIII inhibitors by appropriate clinical observations and laboratory tests. If assessment of plasma factor VIII activity is needed, it is recommended to use a validated one-stage clotting assay. The Altuvio factor VIII activity level is overestimated by the chromogenic assay and a specific ellagic acid-based APTT reagent in one-stage clotting assay by approximately 2.5-fold. If these assays are used, divide the result by 2.5 to approximate the patient's Altuvio factor VIII activity level. Adverse reactions. The most common adverse reactions, greater than 10% of subjects reported in clinical trials, were headache and arthralgia. Please see full prescribing information